welcome everybody to our webinar on Women and Celiac, Unveiling the Role of Women. We are delighted to have you all and really looking forward to a very lively and fruitful discussion about this important topic. I think we are in a great company with our panelists, and I'm sure you will find the discussion useful. As you know, this webinar has been organized in the context of the Awareness Raising Week that celiac societies organize every year about celiac disease, gluten intolerance, and so on. And we hope that in the next 45 minutes, we will be able to address important questions you may have, or maybe doubts, or even curiosities you could have about celiac disease and how it looks like living without gluten, particularly from the perspective of women. To ensure that we use or we have the best use of our time, I have mute you, but please don't hesitate to use the chat to write your questions as they come. You don't need to wait for the end of the discussion of the panel, but you can keep writing your questions, your concerns, your comments, and then I will open the floor for making sure that all these questions are addressed to our excellent and distinguished panelists. And so now, without further delay, I would like to introduce this distinguished panel to you. Certainly, I'm extremely delighted and grateful to count with such a great level of expertise. It's a great combination of different angles of how to look at the celiac disease. And thank you very much, all of you, for agreeing to be part of this webinar. Because it's about women, I will actually start introducing the only man in the panel today. So Dr. Marco Silano, he is a senior researcher and director of the Department of Food, Nutrition and Health at the Department of Food Safety, Nutrition and Veterinary Public Health in Italy. His main research fields consist of pediatric nutrition and food intolerance, and he is member of numerous working groups of the Ministry of Health on breastfeeding, infant nutrition, and weaning celiac disease and nutritional safety. Thank you very much, Dr. Marco, for being here.
Thank you for inviting me. Thank you very much.
And I know that you had another panel this morning, so double thank you for you and your time. Thank you so much. Let me now continue introducing you Paula Crespo Escobar. She's Associate Professor and Coordinator of Human Nutrition and Diet degree in the European University of Miguel de Cervantes. She's also member of the European Federation of Associations of Dietitians, EFAD, and she's Vice President of the Association of Nutrition and Diet Profession in the community of Valencia in Spain. Thank you so much, Paula, for being here.
Thank you for inviting me.
And welcome. And last but not least, we count today with the presence of Susanna Neuhold. She is a food safety specialist with extensive experience in analytical, regulatory, and management aspects of food allergens. Currently, she works as the National Food Area Manager at the Italian Society of Celiacs, AIC. And she is also an active member of AOECS, and she comes with relevant experience in advocacy, lobby at the European level, but also managing patient center non-for-profit organizations. So thank you very much, Susanna, also, and a warm welcome to you as well.
And thank you, the AOECS board, for inviting me to take this, to join this this very good webinar today. It's an honor for me. Thank you.
Thank you. The honor is ours. So maybe to start setting the scene, I will give the floor to Dr. Silano to see if in a very easy manner, how could we explain or give an easy explanation around celiac disease and gluten intolerance, so people understand a little bit what we are talking about.
Yes, thank you very, very much again for inviting me. It's a real pleasure and an honor to be with you even virtually this afternoon. Celiac disease is a multifactorial condition triggered in genetically predisposed individuals by the ingestion of dietary gluten. Gluten is a protein from some cereal, such as wheat, rye, and barley. From a clinical point of view, celiac disease is characterized by a variable combination of three factors: symptoms, autoantibodies, and enteropathies. So one of the reasons why it's so difficult to make diagnosis of celiac disease, I would like to remember that in Europe, just 1 out of 3 celiac patients is diagnosed. We have roughly the 75% of celiac patients in Europe still undiagnosed. So the reason why it's so difficult to make a diagnosis of celiac disease is just because celiac disease shows up with the different combination of symptoms, autoantibodies, and enteropathy. So if we are not able to search for all three these aspects, we fail in diagnosis celiac disease. Gluten intolerance historically are some words used as synonymous of celiac disease. But nowadays, sometimes, and this is quite confusing, gluten intolerance are terms used to describe another condition that is also known as gluten sensitivity, that is a very gray area. Some experts still put in doubt the real existence of gluten sensitivity. So, but if our attendees are interested in, we can come back to gluten sensitivity during the discussion.
Excellent, brilliant. And so maybe in giving the angle of a nutritionist, Paula, what would you like to add to this first setting the scene from Dr. Silano?
Okay, so first of all, thank you again to the Association of European Celiac Society for inviting me to be part of this fantastic webinar. And thank you also for your great work in the defense of celiac population. I think that it is very important. As you know, the only treatment for celiac disease at this moment is a strict gluten-free diet. But regarding the treatment, I always like to emphasize that it is very, very important that the gluten-free diet should be initiated only after the confirmation of celiac diagnosis. The gluten-free diet, as you know, is not a trend. It is a specific treatment for celiac disease. And focusing in healthy gluten-free diet, my topic, one of the big challenges for dietitians is to achieve that patients follow not only a safe diet, but also a healthy gluten-free diet. Mm-hmm. But what is healthy gluten-free diet? I always say that the basis should be the same, that normal diet, but without gluten. So this means that you have to base your diet in naturally gluten-free products, such as fresh meat, fresh fish, egg, legumes, nuts, fruits, vegetables. But we have also considered that there are some particular nutrients in which we can find deficiencies in celiac patients. So after a long term of gluten-free diet, the evidence has demonstrated that there are common nutritional deficiencies in celiac disease. Mainly, we can find protein imbalance, lower fiber intake, iron and folate deficiency. And from the practical point of view, how we can address this deficiency. regarding the protein imbalance, the problem is that most of gluten-free products are made with raw material that are poor in protein, so mainly rinds and corn. But eating meat, fish, legumes, and eggs, we can supply the needs of proteins. About the low fiber intake, this is one of the tricky challenges for the patient. The general recommendation is to consume products with whole gluten-free grains, but the fact is that these products are not very tasty. So what can we do? To meet the recommendation of fiber intake, we can include in our diet at least 3 pieces of fruits a day, 2 portions of vegetable, and we can include the known as pseudo cereals, which are buckwheat, millet, teff, and quinoa. These foods have a high amount of fiber and healthy fats and are rich in vitamins. So we can use the flour of these cereals for homemade breads or sweets. And finally, regarding the iron and folate deficiencies, I would like to highlight that these are 2 of the most important nutrients in the women's diet. On the one hand, the women in general have more risks of anemia because of the blood loss during the menstruation. And on the other hand, the folate is one of the vitamins that should be supplemented in the women who are looking for a baby. And additionally, iron and folate are one of the most common deficiencies in celiac disease. So we have to be alert in the celiac woman follow-up. And what about gluten-free products within the gluten-free diet? These products can be included occasionally as part of healthy gluten-free diet, but as in the same case of normal diet, we have to encourage to the patient to increase the consumption of naturally gluten-free products, avoiding the very processed foods. As with gluten-containing foods, the quality of these gluten-free products can be still improved, mainly regarding the salt, energy, and saturated fatty acid. And the food industry should be also encouraged to improve the nutritional quality of gluten-free products, trying at the same time to reduce the price. And to achieve all this commitment, we have to work in the nutritional education of celiac people, but also in the nutritional education of all population. And I think that this is the best tool for following a healthy gluten-free diet. And maybe you are wondering what is the relation between this information and the role of women, the topic of this webinar, because the official guidelines about celiac treatment indicate that one of the most effective methods to guarantee the adherence to gluten-free diet is the nutritional evaluation and the advice by a dietitian. And in addition, according with the data published about the gender ratio in our profession, is about 80% of dietitians are women, whereas 20% are male. So the dietitian and the women, I think that we are one of the key parts to get the adherence to the gluten-free diet for celiac people and of course, a healthy diet. Thank you.
Thank you so much. You have already spiced the discussion. I'm gonna say, what is the answer from Susanna? Also, from a practical perspective, how do you see this advice from the doctor, from the nutritionist, coming together into practice?
We have seen that celiac disease is a chronic illness, and the gluten-free diet must be followed all over your life. So this implies a great burden, and we can define this burden in 3 ways, because it is a practical burden, because you have to organize your daily life to have safe gluten-free foods, but it's also an economic burden, as Paula has said before, because these products, the gluten-free food products, cost a lot more all over the world, more than their with gluten counterpart. But the big burden is a social burden, because you know that eating is a way to stay together in many countries, to stay with your family, with your friends, with your colleagues. So you have to cope with all these burdens, and it's not easy. What I can suggest from a practical side is to get informed. This is the first step. It is very important to get information, and this could be done through your local celiac associations that could give information about which kinds of food you have to choose for your diet. And how to read labels. This is a great burden because many times you have to read the labels to see if a food product contains gluten. So the Celiac Association can help you in giving tips and information on how to choose ingredients. We can give also help in organizing at home. This is very important when you have a diagnosis of celiac disease, because you have to organize your kitchen. For example, you can choose to have dedicated shelves and cabinets to take the gluten-free ingredients, and you will have to follow some very simple guidelines in order to avoid the contamination. So use clean surfaces, clean utensils. You have to be careful, but you should also know that a normal dishwasher or normal washing with soap is enough to remove gluten. So you can also be sure that this is okay to avoid the gluten contamination. And of course, you will have to be careful when handling gluten-containing ingredients like bread, like flour, in order not to handle them near the gluten-free foods and could get a contamination. So you will organize your kitchen in this way, and it is not so difficult. It's possible. As regards the economic burden, this is a very big problem all over the world. But you can ask your national association which kind of benefits your government provide for celiacs, because in many countries, fortunately, governments help celiacs to buy gluten-free foods to help the compliance to the diet. So they could also advise where to find the more affordable foods, where foods are cheaper. And so in this way, you can cope with this problem. But as Paula has very good said, another good suggestion is not to focus on the gluten-free specialized foods that, okay, are good. You need bread, you need pasta, of course, but you can prepare them at home using naturally gluten-free flours. So you can, if you have time, if you enjoy cooking, you can join, for example, cooking courses from the celiac associations, and you can have fun and prepare healthier food products at home. And this also allows you to have to reduce the cost of foods, because of course this costs less than buying the finished product. And at least the social burden is very important, as I have said, because it is something that you take all your life long, because every time you eat out of home, you will have the problem to find a gluten-free meal. For this reason, the celiac associations, many celiac associations, has developed certification programs for venues, and venues are trained and monitored by the celiac associations. So you are safe, you are sure that their people know what the problem is and how to handle it. But also when you can't find an accredited venue, it's possible to eat out of home, because the most important thing is information. So you have to inform the waiter of your problem. You can ask for the ingredients used and the ways they prepare the meals. And in this way, you can be sure that the meal that you are ordering is okay for you. So my key messages are this: keep calm, get informed, spread information also among your friends, among your relatives, because the more the people will know what is celiac disease, what is gluten-free diet, how to avoid the contamination, how to choose the gluten-free foods. For example, the cross-grain trademark is a great project from the celiac associations that help people to immediately recognize if a food product is safe for them. In this way, you can cope with this burden. it's important that it is recognized by the society that the celiac people have this burden to take every day, but it's possible to handle it and to live a normal life as all the other people.
Wonderful. So that's a very positive and encouraging message that you give us, that I'm sure the audience will appreciate. I was now making a little bit the link between what Paula says, the ratio in terms of women, 80% of nutrition has been women. And I also know that from the patient perspective, right, Dr. Silano, there is also a big proportion of women being celiac. What are the reasons for that ratio? Or I don't know if it's one reason or several reasons. Could you please elaborate on that?
Yes, the ratio regarding the prevalence of celiac disease, the ratio of women, men is from 3 to 1 to 2 to 1 according to the studies. There are some reasons to explain this proportion. The first is the fact that the pathogenesis of celiac disease is on autoimmune basis, because celiac disease is an autoimmune disease. And because of the hormonal balance, women are more prone to develop autoimmunity respect with the men. So this is the first and the pathogenesis explanation. The other one is a bias. The women are more prone to go under medical examination where they are young, because there is a very important event in the life of most women, that is the pregnancy. So they go to the doctor earlier than men do, for being to the gynecologist, for being followed for their pregnancy. So they are more prone to be evaluated from a medical point of view. So there is a diagnosis bias, because they perform medical analysis, blood examination earlier than men usually do. Another aspect very important is also that some symptoms and signs of celiac disease have an important impact, an important burden on the pregnancy, because amenorrhea, dysmenorrhea, alteration of the period are very often symptoms of undiagnosed and untreated celiac disease. And there are also some obstetric conditions, pathologies related to the celiac disease, such as stillbirths, frequent stillbirths, such as small baby for the gestational age, or premature births. So this is taken together are the reason that can explain why we have more diagnosed women with celiac disease, respect with the men.
Oh, great. You are really open I'm very interested in all the reasons that you are giving us. I think that clarifies a lot the perception that we have sometimes. And you mentioned also the important event in the life of many women of getting pregnant. And I wonder, and that question will be for Paula, if there is a specific diet, or how could be the diet of a celiac woman that is seeking for getting pregnant? Does it need to be modified? Is there some piece of advice that can be given?
Yeah. Well, I think that this is an important question and very relevant in the context of this webinar. As I said, one of the main deficiencies in celiac disease is the folate. And this vitamin is very, very important during the previous period to get pregnancy. And it's widely recommended to start with the supplement before pregnancy, although you don't have this deficiency, because it has been demonstrated that this supplementation prevents damage to the baby. So Therefore, if you consider that in celiac women we can have a previous deficiency of folate by the disease, we have to be aware that we need to check our blood status if we want to get pregnancy. And we have also included in our diet, apart from the supplement, food rich in this vitamin and gluten-free, of course, green vegetable like broccoli, artichoke, leek, and also some legumes and fresh fruit like orange, banana, and nuts. I think that this is the main recommendation for this celiac population.
Fantastic. And that could be maybe, Susanna, related to, so I'm trying to make the picture of, for example, a person that is being very well already or diagnosed, and they have to take the first steps into, you know, how to involve the family, how to adapt their lives. What will be? You mentioned already a lot of suggestions during your presentation. But what could be the adaptations, and also maybe the typical mistakes they do when shopping, when taking their celiac disease in consideration?
Yeah. As I've said before, one of the main mistake is to focus the diet on the gluten-free products. Instead, it would be better to focus on naturally gluten-free foods, because as regards the nutritional guidelines, for example, that we have here in Italy, just the 35% of our calories should come from substitute foods like bread or pasta or biscuits. This is a big mistake to eat and to buy all these products. You don't need so many. And it's possible to have a very good and healthy diet choosing the naturally gluten-free foods like cereals, gluten-free cereals, like pulses, legumes, vegetables, and so on. Another big mistake I think is made is to be too much worried about the gluten-free diet. It is very important to have a balanced and serene approach to the diet. This helps to cope with it. And for this reason, there are many services from the celiac associations for helping people. For example, there are self-help groups where you can share your experiences, you can share information, and they are very supportive when you start your new life with celiac disease. We have also other services like the Food and Drink Directory, the list of accredited menus, and many other services like the support of a dietitian specialized in gluten-free diet. This is very important when starting a gluten-free diet, also to have the consultancy of a dietitian. I think that again, obtaining information from dietitians, from doctors, from your celiac society is the first step to cope with celiac disease, and it permits you to have a good life without worrying too much. You have not to worry too much, because we don't let celiac disease ruin our life. We should accept it and learn how to live with it. So this is important.
Very good, very good. And I wonder, yes, again, this is also related to, you do your life, maybe you are not celiac, but your partner is celiac. Maybe someone has symptoms, another don't have symptoms. And I want to ask Dr. Silano if there are differences in the symptoms by gender, if there are, well, you mentioned already there are some specifics signs that are specific for women, but could we say it also that there are different symptoms, or in general we can say there is no gender difference?
No, we can say that celiac disease is gender specific because of the higher prevalence among women respect to the men, and because the very important symptoms are referred to the obstetric and gynecological systems. The other symptoms are the same in both sex, in women and in men. For example, even if these symptoms can have a higher impact in women than in men. Just two examples to make me clearer. One is anemia. Anemia is a very frequent symptom of celiac disease at onset. Usually anemia is has a higher impact in women than in men, because women already have anemia because of their period. So fertile women are more prone to anemia. So a further cause of anemia is has a higher impact on the symptomatology. The other one is osteoporosis. Women are more prone to osteoporosis, again, for the hormonal balance and as respect with men. And the malabsorption of calcium due to untreated celiac disease can make the osteoporosis in women more severe and have more consequence. So there are some symptoms that are not specific for women, but that in women have a more evident symptomatology.
Correct. Very good. And now that you mentioned about the osteoporosis, I wonder, for example, if a woman has been not diagnosed until very late, is there something from a diet perspective that she can do that to improve her let's say her approaching towards menopause, Paula?
Yeah. This is another tricky issue, because one of the consequences of not follow a gluten-free diet could be this kind of health risk as osteoporosis. So, and this is one of the most health problem in elderly women. So, and it's more frequent in women than in males. So, in these cases, we have to meet the recommendation of two main nutrients. In this case, calcium and vitamin D. And we have to increase in our daily diet the consumption of, for example, milk, dairy, like yogurt, cheese, salmon, mushroom. And it's also very important to include physical activity in our life, because the physical activity, and this is one of the key factors also to fix the calcium in our bones and to improve the osteoporosis. So we have to be focused in calcium and vitamin D in these cases.
All right. All right. Yeah, I have a few questions for the three of you, but before I want to ask a question to Susanna that can give us some tips on the non-celiac friends, like some of us, what can we do for our celiac friends? How can we support them in this journey? What kind of advice could you give us when socializing, or what could we do?
The society should know better about celiac disease and gluten-free diet. This is something that we see every day, that nowadays celiac and the gluten-free diet are always talked about. Everybody is talking about the gluten-free diet like a trend, but indeed there is not a great real knowledge of it. So it is very important, I think, to inform people and not to be shy. It's important to spread knowledge about the gluten-free diet, because it is important to understand that it's not a trend, but it is a therapy for a lifelong chronic disease. That could have also great problems if not follow this diet. So it's important to inform your friends, your colleagues, for example, teachers at school. It's important to ask for help, not to think to cope with this problem alone, because this is a problem of our community. When people has a specific dietary need or has a specific health need, it is a problem for all the community, all the society, and all the society should respond to it. It's not a burden that only the person with celiac disease or other disease has to take on him or on her. So again, what we can do is to inform our friends about the foods we can eat, how to prepare them, avoiding contamination. Contamination is when you accidentally put some traces of a substance in a food, and in this way you have little traces of this allergen, for example, in a food, and this could be very dangerous for people, for allergic people or for celiac people. So it is important to be careful when preparing food for celiac. You should avoid that foods come into contact and could happen this contamination. So we have also, we celiac societies as, for example, Facebook pages where we share information on the gluten-free diet. We are available by phone, by emails, on Facebook to reply to questions of friends, and we are very happy to spread this knowledge about gluten-free diet. So what we can do is to talk about it, the more we talk about it, the more the society will be able to host, to help celiac people to live a good life.
Thank you so much, Susanna, for the good advice. There is a question from the audience that I think is, well, it could be for all of you, that is related to, in the case that the mother is celiac, should their grown up, their children, daughters, be regularly monitored by gastroenterologists as they were children? And and the person is suggesting they have genes for celiac, but doctors are refusing to monitor them regularly. What is the guidance or your impression here? Maybe Dr. Silano can guide us a little bit.
Yes, celiac disease is has a genetic component. So when one of the parents is celiac, the risk for the children to be celiac is higher than the general population. The risk to be celiac in the general population is roughly 1%, is 1 out of 100 people. In the siblings, in the first degree relative of an already diagnosed celiac person, the risk is 15-18-fold higher, is 15-18%. So in this situation, there are two strategies that are both effective. The child, the daughter, can be checked for the genetic predisposition. The genetic predisposition of celiac disease consists of the presence of the gene that codifying for DQ2 or TQ8, that are some molecule that are present of the leukocyte. Leukocytes are the cells of the immune system. So the child could be checked for the presence in the genome for the genome encoding for this molecule. If this gene is present, then the child could be checked for specific antibodies called antitransglutaminase every 2 years. But if the genes, the predisposing genes are not found, so there is no way, no possibility that boy or that child could become celiac. This is the first strategy. So check the genome for the predisposing genes, and then following over the time only children with the predisposition. The other strategy is skip the genetic exam and just going for the antibodies determination every 2 years, or even earlier if there are some symptoms suggesting celiac disease. The strategy from a scientific point of view are both very effective. Of course, is the national health system that has to support the parents in the decision. Because, for example, the genetic examination or the antibody examination are made both on a blood withdrawal, on a blood sample. But the genetic in Italy, for example, costs 250 euros, and the antibodies determination costs only 15 euros. So it's the national health system that decides which of the two strategies is to prefer. Anyway, something that should be made.
Okay, well, I'm sure that the person that asked this question got great clarification from you. Thank you so much. I have another question for all of you, because I realized that time has flight. It's amazing. I think I could stay the entire day listening to you. It's really, really impressive what I'm learning, and I hope the audience is also getting a lot of information. This question is about the future. So how do you see the future of gluten-free diet? If, for example, in the early future or medium future, there are pills or medication available for celiac disease. Who wants to start? It's very futuristic, maybe?
Maybe. I think that in general, I think that the awareness about celiac disease has increased a lot in recent years. So not only among the medical community, also among the general population in restaurant, the school. So I think that this makes the social life of celiac disease much easier for these people, and this helps to improve the adherence to gluten-free diet. So, and I think also the gluten-free market increased in general. So I think that we have a great and healthy future for the gluten-free diet at this moment.
Excellent.
Yeah, if I can add something, as Paula said, the gluten-free products have a lot improved in recent years, and can be improved more in the future. So this is something that you can see for the future, better food products for people, and also more choice for people. Another important thing I think that we can work on, like dietitians and celiac societies together, is about the empowerment of the celiac patient, because the celiac patient can become very careful about his or her diet, can learn, for example, how to read the nutritional label. This is very important because there are so many products but they are not the same. There are many differences from one to another. So if a celiac is able to read the nutrition label and choose the healthier product, this could help really to have an healthy and balanced diet. So I think that to encourage food producers to produce better foods for celiacs and to educate and teach celiacs to choose healthier foods is the future for both for the celiac associations and both for the dietitians. This is our goal together.
Well, thank you very much. Last word, Dr. Silano, or?
If I had something regarding gluten-free diet, from a medical point of view, Paula said that gluten-free diet is a therapy, but is a therapy that has one is natural, because as we already have been told, there is the natural gluten foods. So it's a natural therapy. Does not have any side effects, because if followed by a trained dietitians, gluten-free diet does not have any imbalance of nutrients or of micronutrients. So as a therapy is cheap, because of course we have already told that is more expensive. The gluten-free diet is more expensive than gluten-containing diet. But respect with a therapy such as just speaking about insulin in diabetes, gluten-free diet is much cheaper, so it's cheaper as a therapy. So from a medical point of view, I think that we will not have an alternative therapy to gluten-free diet in a very short and medium term.
And I think that's good news. Anyway, well, I want to put you in the challenge of coming back soon, because I think many questions were open and we couldn't address them all. So I really will invite you again, I don't know, maybe in a few months, to continue this wonderful conversation. Thank you.
Thank you very much.
And